and we found her vitamin D was low, her caloric intake was very low compared to how much she's expending. And all of that kind of came to be what we call osteopenia or kind of a loss of bone mineral density.
Welcome to the Motion Lab, the podcast that explores the science of movement and helps you live a stronger and healthier life. Welcome back to the Motion Lab podcast. My name's Chuck Dowell. I'm one of the physician assistants here. I'm here with Dr. Jamie Friedman.
I'm Dr. Jamie Friedman. I'm one of the board-certified orthopedic surgeons here at CSAUG.
So today we thought it'd be good to do a podcast regarding nutrition, but not in the normal sense that you see podcasts regarding nutrition. So a lot of podcasts for that are on sports performance and enhancement, but we want to talk about it from the orthopedic perspective. So oftentimes nutrition can affect how patients heal or possibly injuries that patients can have. When you're seeing somebody in clinic, when do you start to suspect a possible nutritional deficit or concerns regarding that? What are the signs you look for?
Yeah, so we'll see patients who come in with repeated injuries of, the same knee keeps hurting or something like that, or they're not healing their injury as we expect them to. And usually that's kind of a sign of either overtraining or maybe not letting you heal or not having the proper nutrition to allow your body to heal.
So when we think about nutrition from an orthopedic standpoint, there's a couple common conditions that we think about. We think about the athlete triad and we think about overtraining. Can you discuss a little bit more about the athlete triad?
Originally, it was called the female athlete triad, and then we kind of realized this applies to females and males across the board. So then it became the athlete triad, and now it's actually called RED syndrome. So that stands for Relative Energy Deficiency in Sports. Mm-hmm. Basically, what that means is you're not keeping up with the energy demands that your body needs to enable to play the sport that you're doing or the activity that you're doing. So you're not putting enough gas in the tank to drive the car or drive it well. And so that can have a lot of downstream effects, such as injuries or not healing injuries either. And that's kind of the big topic right now. So
yeah. And then overtraining is very similar. That's, doing too much training, 5 hours a day of doing a lot of activities and not allowing the body to have appropriate recovery afterwards. And nutrition is obviously part of that recovery.
Yeah. We see a lot of, single sport athletes year round training 5, 6, 7 days a week in their sport, which it's great to have a passion, but I really emphasize a lot of cross training.
Yeah.
A lot of days of rest, a lot of days of recovery and things like that in between your sport to make sure that you can maximize the sport that you enjoy. And so, for example, if you're a soccer player and you want to play soccer, that's great, but maybe throw in some yoga, throw in a day of getting on the bike or something else, do some weight training in between, and then take a day of rest and let your body heal.
And we've talked about that actually in the last 2 episodes when we did one about kids in sports and we did the ACL episode. It's important to not do uniplanar activities. Multiplanar activities we know significantly reduces injuries and allows the athlete to be a better athlete. And so, that's kind of what you're recommending from that standpoint. When you see somebody that comes in and you're concerned about a possible nutritional deficit or a prolonged healing for something that shouldn't take that long to heal, how do you screen that? Is there specifically lab tests you order or, a discussion you have?
Yeah, so first we just want to know what the sport is, how much they're playing, how involved they are, and kind of, see if that's the first problem, right? The too much too often. And then if we're seeing really, if we see like problems healing and stuff like that, we might order labs. Some of the most common might be, calcium or vitamin D deficiency, iron deficiency, especially in females, and just other nutritional problems where they're just not getting enough from the regular diet to make their sport happen. And then, of course, we get things like x-rays or certainly MRIs if there are more serious injuries that we're worried are not healing as we would expect or other pathology we need to investigate.
Yeah, and I think it's important to realize it's a multidisciplinary approach, right? I mean, we're looking at it from an orthopedic perspective, but we also want a nutritionist involved. We want the pediatrician involved, maybe some psychologist, involved from a therapy standpoint if there is an eating disorder that's underlying causing it. So it's definitely important to get the whole team involved to help that athlete become, better and to reduce their concerns for these type of syndromes that we're seeing. So as not to get too far in the weeds regarding a conversation about nutrition itself, what are your general recommendations? I think there's a misconception regarding how many calories I need as an athlete. We were just discussing this before that. I don't need a lot of calories because I don't do as much sports as these young, healthy, kids are doing. But what's your general recommendations regarding that?
So we were just talking that, the average person needs about 1,500 to 2,000 calories for just regular activities, but a young athlete needs a lot more. And so I don't remember the numbers off the top of my head, but for example, a female soccer player might need something like 30 calories per pound per day, and that
Mhm.
will add up to over 3,000 calories or more, even 4,000 calories per day. And that's significant, and that's a big change. That's twice as much as the low threshold of the general population, and that's just to play a sport,
Mhm.
not extra training and things that go into the sport. And so you have to recognize not just calories, but how those are divided up, right? Our macronutrients, our carbohydrates, our proteins, our fats, and make sure that we have a balance of that and that they're good fats and good proteins and good carbs going into those too.
Yeah. I mean, I think you have to understand that nutrition is so important and caloric intake is so important. And, it's all about energy balance. And you have to balance the energy you're expending with the energy that you're providing to your body. And unfortunately, if your body doesn't have the appropriate food to use as energy, it's going to use other things as energy and it's going to cause different problems, hormonal imbalances, poor uptake to the bones. So the bones will become weaker with the osteopenia, and that can lead to fractures and that can lead to injuries. And so it's important for athletes and parents of athletes to realize the importance of nutrition. So it's an interesting topic too. So when I was playing basketball, we won't talk about how long ago that was. We used to carb load, right? So the night before we'd have the pasta dinner, and the coach would take us out, and we'd all eat a bunch of pasta. But maybe you can discuss a little bit. Carbs are not the most important part. They're an important part, but not the most important part of the nutrition. When you talk about that balance, is there specific or general recommendations regarding carbs to protein or how to get your protein?
Yeah, I mean, there's a different balance, and that's certainly something that a nutritionist could go deeper on.
Mhm.
But carbs are important. They give us kind of that, like carb loading. They give us that short energy, or not the energy we need for the game, but not
Yeah.
energy over a long time, right?
Correct.
Proteins are very important for muscle building, muscle health, maintenance, things like that. And then, believe it or not, fats are important too, but we want to
Very.
make sure they're healthy fats. So eating a lot of Snickers bars and Chick-fil-A isn't great.
Yeah.
Everything in moderation, right? Not
Yeah.
saying you can't have it. But like avocados,
Mhm.
nuts, peanut butter, things like that are actually healthy fats, and those are important for the body too. Those are used as energy, but just in a different way than carbs, and they're a little bit longer energy over time. So
Correct. I mean, when we're talking about athletic performance, like in a game, your primary source of energy is ideally carbs. And if you're
Mhm.
not getting enough carbs in, your body's going to use other sources, like let's say protein, and then that protein won't be there to cause muscle development, and you may not then, get the strength that you're looking for. So, ideally, the recommendation is carbs for the in-game, activities, and maybe at halftime you can do oranges or Gatorades, and that's not to advertise Gatorade at all, whatever sports drink you want. But that's why those sports drinks have carbs in it, because they're quick absorbing carbs that you can then use for the second half, because your body depletes its carb resources within 60 to 90 minutes. And so if your activity is going to last longer than that, you're going to need appropriate nutrition for that. But it's not the day before. That's what I learned. You don't want that stomach full of the carbs the next day. It's 2 to 3 days prior is when you want that carb load in. So, and when we talk about protein, supplements are always out there, right? So there's different types of supplements. There's some that we do recommend, some we don't recommend. Protein shakes are obviously an easy way to get your protein in. What's your general recommendation regarding supplements?
So I think protein as a supplement is fine. To be honest, the best recommendation is a healthy, well-balanced diet, right? And then I always tell my patients a multivitamin, usually a multivitamin directed towards you. So if it's a pediatric multivitamin or a men's multivitamin, or a women's multivitamin, which might have a little bit different substances in there, is really what you should base your health on. But then if you do need a little extra protein to help with your training or building muscle or maintenance, you just got to make sure you read the labels, right? Because there are proteins out there that are full of sugars and full of caffeine and full of, other stuff that you don't want in there. You want to make sure you're getting something that's a little bit more pure and the protein that you're looking for.
Yeah, and there are third-party testing in some supplements, and so sometimes the label will have a third-party testing on there, which oftentimes is helpful to know that that's a supplement that's gone through some kind of testing and not just testing by the provider or the manufacturer itself.
Right.
They're not covered by the FDA, so we don't have a global, screening for them. But if you can look at the label and see there's third-party testing, that can give you some assurance that there's appropriate ingredients in there.
Right.
It's interesting because when I did my nutritional stuff, most athletes get enough protein through their diet. It's typically not protein what they're lacking. It's usually the fats and the carbs that they're lacking oftentimes, because they're resistant to use those because they think it's going to cause weight gain or some issues, and they don't know how much it's going to improve their athletic performance.
Right.
So let's talk about if you've seen somebody. So give us an example of a patient you've seen that had maybe a prolonged recovery or an injury that was maybe associated with, a caloric deficit or possible one of these syndromes we're talking about.
Yeah, absolutely. I had a 16-year-old female high school track athlete, fantastic athlete. She trained 7 days per week, 8 if she could, and ran high mileage. She was a cross country, she did the distance running, and she came to see me with right lower leg pain.
Mm-hmm.
And ended up through x-ray and then eventually an MRI with a tibial stress fracture, so a fracture of the shin bone.
Mm-hmm.
Now we can treat that conservatively, but it was with rest. She actually didn't rest because she just wanted to keep pushing through the pain, and it prolonged her healing for months.
Mm-hmm.
And eventually we got her to rest, and she had to do some rehab, and we really had to send her to physical therapy, gait training. We sent her to a nutritionist, and we found her vitamin D was low, her caloric intake was very low compared to how much she's expending. And all of that kind of came to be what we call osteopenia or kind of a loss of bone mineral density. And so that's where you get those stress fractures. Now, exactly. And once we've kind of put her through this workup, she finally got the picture that if you take the time to rest and heal and recover and balance your body, then she can get back to it. But the more you just keep running and pounding on it, the longer it takes. Mm-hmm. And so it took her a while, and then she got back to it. She actually won the national championship for her high school, which is amazing. But, it took some time and some thought and a lot of, behavioral changes of her to realize that we got to play the long game and get her healthy again.
Yeah. And she had a little bit of both what we're talking about, right? So she had some overtraining for sure. She was doing a lot of training, which necessarily is not a bad thing, but she was also not giving her body the appropriate fuel to recover from that training. And, then again, a little bit of that athlete triad where she had, low caloric intake. So she had poor energy balance, and that led her to developing, the fracture. And unfortunately, a lot of athletes, their identity is sports, right? So that's the hardest part for us from an orthopedic perspective. When somebody comes in with an injury, there's a psychological component to it, right? We're taking their sport away from them, which we're taking their identity away from them. And that's a difficult conversation to have, but it sounds like you were able to get her into some therapy to help with that aspect as well.
Yeah, telling a runner not to run is like taking their life away.
Correct.
So, but it's always we're trying to be in the positive, right? Like we're there to help people get through this. And it's not always easy to hear that you gotta rest in the short term to play the long game. Mm-hmm. And for her, a big component of her continuing to be really mentally okay with this was us talking about cross training with low impact activities. So we got her on a stationary bike. We got her in the swimming pool. We actually did some yoga and Pilates with her. And those were things that she could feel like she's still exercising and getting her heart rate up with some of these. And some aerobic capacity, but not the impact that she was having with running.
Yeah, so she was still able to kind of scratch the itch. She was still able to do
Yeah.
something where she got her heart rate up, get that kind of, endorphins or, whatever she gets from the sports itself, but not necessarily causing further harm to herself. So I think that's the important part is, we're not trying to take the sport away from them. We're trying to allow them to play the sport, but to then get healthy and play it appropriately, which is sometimes a difficult conversation to have.
Absolutely. That's why I tell so many of my patients, I'm not here to take your sport away. I'm here to keep you going.
Yeah.
We just got to find a way to get there.
Yeah, exactly. And I think it's important to get the parents on board with that as well, because they're obviously the ones that are interacting with the athletes on a daily basis. And if they can help us to encourage them to get appropriate nutrition and to kind of give their body some time for rest. Now, when we talk about rest and overtraining, where do you think you come into that? If somebody comes in and they're training 5, 6 days a week and you're starting to see some of those overuse or overstress type injuries, what's again your recommendation regarding that?
A lot of it is just general counseling. A lot of it is how do we cross train? What's our nutrition like? Do we need to go down the path of lab work or imaging, things like that? And just getting to know the patient and what their goals are and how do we get them there. But it's hard. It's hard. It's not an easy conversation, right? It's easy when somebody breaks a bone and I can tell them I can fix their bone.
Yeah.
It's not easy when we say this is some sort of kind of less tangible problem, although it might be knee pain or something that they understand, but it's less tangible for them to know, like, okay, this is a whole body process. This isn't just your knee that we've got to fix.
Yeah, and soft tissue injuries are obviously much more unpredictable. Bone injuries, we are very predictable for us, but when somebody has a soft tissue injury like a hamstring strain or like a knee pain, it's much more unpredictable for us, and we have to try to use every tool we can to try to get that better. And oftentimes, nutrition does play a role into that for sure.
And rest and rehab. I mean, physical therapy is so important for my high school athlete, getting her back into the gait lab, getting her running, without like a gallop anymore, just her biomechanics were off, and making sure they're going progressively in the right direction. You can't just go 0 to 60. You got to start slow. You got to, cross train. You got to hit all your areas and then keep progressing. So.
And I think it's always interesting because if we're able to have that conversation with them and we're able to change their habits, they become a better athlete, right? They realize that they're not sick as often. They have more energy to exercise. They don't have that bonk or that kind of mid-game kind of fatigue because they have appropriate nutrition. And overall, they just feel better. They're more alert. There's a lot of benefits to appropriate nutrition. And if we can get the athletes to buy into it and to do it, it's interesting how they realize how much better they are.
Absolutely.
And then they're hopefully going to make a lifestyle change where they'll do it for the rest of their life.
Yeah.
And then, thanks for coming in for the episode. Anything else that we didn't necessarily cover that you see regarding these type of issues or concerns?
I think one thing that we think about nutrition as just kind of a food issue, but one thing, especially here in Colorado, is hydration.
Yeah.
It's super important to hydrate, even before your game or sport in the morning, and then before the actual play and during play and after, and whether water or a sports drink or something to hydrate, especially here. I mean, it's dry, and we see dehydration. We see heat problems and things all the time here, and that's something that is part of nutrition as well.
Correct.
Yeah.
I mean, even 1 to 3% of dehydration will significantly predispose you to injury.
Absolutely.
Because your body won't be able to, function normally, and then you could have some of these soft tissue injuries or a possible, structural injury because of that. So yeah, as you said, and the energy expenditure is worse at a higher elevation, and so that's why a lot of people come here to train, the blood doping with training. But the importance of the hydration is definitely there as well.
Yeah.
Well, I appreciate your time. Thanks for coming in. And if somebody wants to come in and see you, how do they get into your office? How do they get a hold of you?
So if patients want to come in and see me, I'm happy to see them, talk about their sport, nutrition, injury, or just how to prevent injuries, right? That's half the battle of sports is prevention, not just treatment. You can call the office. You can come on our website and schedule an appointment. I'm happy to see you for that.
Excellent. And then always we have the express care. So if for some reason they're having trouble to get in to see you, they're all welcome to walk into the express care, and we can start the workup and then refer them to you for kind of the further discussion, which is always helpful to them as well. So I appreciate your time. Thank you very much.
Thanks for having me.